Hello, hello, hello. Welcome to Shy Rosalind's Eclectic Experience. And tonight is part two of my discussion on the disparities of healthcare for Black women, particularly for prenatal and postpartum care. The other night, I posted some information and statistics in part one. You can go ahead and check that out when you can. And tonight I'm going to be discussing a New York Times article about one particular woman's journey regarding her difficulty getting prenatal and postnatal care. Um, I don't want to take too much time on it, but it is an important article because it shows the problems, the crisis that we're having. And it's not necessarily just prenatal and postnatal care, uh, um, prenatal and postpartum care, but it's also other types of health care. There are women with heart disease, fibroids, you name it, and it's different. The healthcare system does treat Black women a little differently. So tonight I want to talk about this particular article, and of course, please like, subscribe, and comment. Comments are very helpful. They let me know if everything's working. And likes and subscribe and likes are also very helpful. And if you have questions, you can reach me on my Facebook page, Shy Rosalind at Facebook. Sharing my screen right now, and bear with me a second. I'm gonna scroll down a little bit. So this particular story, she in the spring of 2016, she found herself pregnant with 2 young sons. She was in what she felt was a steady relationship, uh, and unfortunately it turned contentious. 3 months into the pregnancy, he was he had become physically abusive. He was arrested, charged with a few offenses, including battery, um, and unfortunately, the paycheck from her waitress, and she needed his income to cover the stuff. And here's where the healthcare thing comes in. Her hands, her feet, her face was swelling. She couldn't work anymore. And even though friends have recommended her doctor, um, they basically, the doctor, as what she claims, brushed aside her complaints, even though her feet were swollen. And usually, when your feet and your hands are swollen, that's occasionally that can be a sign of a heart problem. Um, so I was kind of surprised to read that the doctor dismissed it. Tylenol for the headaches, and then tragedy struck a few days before her baby shower. She had another migraine. She found out her blood pressure was up, which is probably why she looked. It seems like it was a possibility of preeclampsia, preeclampsia is high blood pressure during pregnancy, and it can shoot very high, and it needs to be treated right away. High blood pressure and cardiovascular disease disease are two of the leading causes of maternal death. According to the CDC, Centers for Disease Control and Prevention. And then here's this young lady who's definitely showing signs of preeclampsia and other. Then she said when she went back to the doctor and said, "Listen, something else." The doctor told her to lay down and calm down. He also, she says that the doctor also warned her that he was planning to go out of town and told her he could deliver the baby by C-section later that day, 6 weeks before her due date. She felt it seemed like an ultimatum, and basically he was more concerned about his schedule and his convenience um, than paying attention to what was going on, which refers back to what I presented the other day. One of the suggestions by one of the directors at the CDC was that medical practitioners need to listen to the patients and pay attention to the symptoms and the signals that there's a complication. Um, and this is an example of a doctor that chose not to do so. And as we'll find out, it turned into a very tragic experience. But I'll find that out in a moment. You are watching the Shy Rosalind's Eclectic Experience. Please like, comment, and subscribe if you're so inclined. Tonight I'm discussing part 2 of the healthcare disparities for Black women in the United States. We're going over a article from the New York Times in 2018, and I put a link to the article in the chat. So if you'd like to look at it at your leisure, you can do so. The New York Times does allow, I believe, 1 or 2 free articles in a month, and then after that you have to subscribe. But I do have a PDF file of the article, so if for some reason you get hit with a paywall, let me know if you like the article. Right. So, let's see. Unfortunately, that day that when the doctor gave the ultimatum was the last day he would see her. Aside from the handwritten note, her medical records do not mention the hypertensive episode, the headaches, or the swelling, and says that the last time the doctor or anyone from his office spoke to her, it was like he threw me away. And this is the young lady. And basically, it seems he did that because he did not want any documentation. He probably realized that he was wrong, that he didn't pay attention to the symptoms, and he didn't pay attention to the change in her blood pressure. And he was basically, it sounds like allegedly, that the doctor decided to hide the information so that she couldn't come back and sue him later. And unfortunately, 4 days later, she found she sent had her boyfriend take her sons to a stepfather's house, and then take her to the hospital in the car on the way. She thought her water broke, but when she looked at the seat, she saw blood. She ended up calling 911 at the stepfather's house, and she basically almost bled out. Further along in the article, says she had elevated blood pressure. She was 160/100, which is basically a stroke. or very close to it. She was bleeding out. Um, and then the worst happened. They couldn't find a heartbeat for the baby. And basically, she was told that her baby died. Um, if she was a if she chances are she would have been able to have a healthy pregnancy, but um, the treatment she received from the first doctor basically was subpar at best. Um, she had to tell her sons that the sister died and that that's her and her two sons. And this was written in 2018. So, um, um, let's see. There's some statistics. Um, let's see. Yeah, these are some statistics. Black infants in America are now more than twice as likely to die as white infants. 11.3 per 1,000 black babies, compared with 4.9 per 1,000 white babies. And it's a racial disparity that was actually wider than in 1850. Education and income little protection. In fact, a black woman with an advanced degree is more likely to lose her baby than a white woman with less than an eighth grade education. Um, and then not only are black infants at risk, but the mothers are as well. The United States is only one of 13 countries in the world where the rate of maternal mortality, the death of a woman related to pregnancy, is now worse than it was 25 years ago. Now, I'm going to stop here for a second because or watch certain I don't want to say the N word manosphere. And I don't want to say the RP. Don't want to say that either. But if you listen to certain broadcasts or podcasts, they talk about, oh, we need more black babies. We need black family. We need more black babies. Women need to, become submissive again and start, being mothers again. Well, listen, if that's what you want, then that's what you want. But here we have to pay attention. Here is a young lady who chose to carry her pregnancy and was treated so badly by the healthcare system where she lived that she not only did the baby die, but she nearly bled to death as well because she was treated so badly. If you want, if you want to push women to sit down, shut up, and get pregnant, then you need to make sure that you're an advocate for said woman, and B, you need to get together with your women and vote and hold the healthcare system accountable. And you do that by going to your local government and going to your state government and even complaining on the federal level and say, hey, listen, this is not acceptable. That's what you got to do. So, it's bad enough that black women are bearing the brunt of basically everything. And it's the truth. They're bearing the brunt of everything. We get treated like shit at work. We get treated like shit at the doctor's office. I probably shouldn't be saying shit because now I won't get monetized. But we get treated like crap at work. We get treated like crap at the doctor's office. We get treated like crap and told that we aren't worth nothing. If we're a single mother, we aren't worth anything. If where we need help or can't afford to have a baby, or you should be having a baby anyway, and are and then the men that we're with don't treat us right either, but that's our fault too. So yeah, anyway, rant over. And then here's another. I just thought of another example. Serena Williams, number one female athlete in the flip world, had her baby. Beautiful baby, by the way. Had her baby. She got all the money in God's green earth. I'm sure she had an excellent insurance plan. Had a husband by her side. Has the baby, and she says, "You know what? I can't breathe." Oh, you'll be all right. They dismissed her. Serena Williams and her doctors dismissed her. It got to the point where she literally could not catch her breath, and they finally did a scan and they found a pulmonary embolism. She had had one before, and it was in her medical record, and they didn't bother to check. Yeah, okay. But yeah, everything's a black woman's fault. Yeah, okay. And that's for another day. But anyhow, let us continue. Basically, the CDC report, more than 50,000 potentially preventable near deaths, like Landrum's, the young lady in the article, rose nearly 200% from 1993 to 2014. Black women are 3 to 4 times as likely to die from pregnancy related causes as their white counterparts, a disproportionate rate that is higher than that of Mexico, where nearly half the population lives in. We're worse than Mexico, y'all. But yeah, everything's a black woman's fault. Anyway, um, let's see. Um, Monica Simpson, the executive director of Sister Song, the country's largest organization dedicated to reproductive justice for women of color, and a member of the Black Mamas Matter Alliance, an advocacy group. In 2014, she testified in Geneva before the United Nations Committee on the Elimination of Racial Discrimination, saying that the United States, by failing to address the crisis in black maternal mortality, was violating an international human rights treaty. Yeah, hello. Obviously, they were. The crisis in paternal death and near death also persists for black women across class lines. And this is where I was talking about Serena Williams. She shared in the story in Vogue, um, about her issue after delivering a cesarean. Actually, she received not. Oh, okay. It was. Let's see. Hold on a second. They found a pulmonary embolism, and then on top of that, she had complications after the cesarean. She had blood clots. And then the coughing triggered by the embolism caused her C-section wound to rupture. Had to take her back into surgery, and they found a hematoma in her abdomen, which required more surgery. So, yeah, it's ridiculous. This whole thing is ridiculous. Let's see. Here's the kicker. For black women in America, in this inescapable atmosphere of societal and systemic racism, can create a kind of toxic physiological stress, which can lead to resulting in conditions including hypertension and preeclampsia that lead directly to. But everything's black women's fault anyway. And the sad part is, after she lost her little girl, um, Landrum's life, that's her last name, grew more abusive. Around Christmas in 2016, he attacked her, choked her. And he said to me, "Do you want to die in front of your kids?" He assaulted her. I'll just say it that way. She called the police. He was arrested, charged with second-degree assault. She got a restraining order, and the district attorney declined to prosecute. She did. She was moved to a safe house at home. And then she had a relationship with another gentleman. Found out and she was hoping for another girl. And the case manager at the Family Justice Center, who helped her relocate after the first boy, got her into a workshop conducted by a doula. Now, a doula is a person who advocates, and there's a doula. The doula is not a nurse, but they are trained to assist men have a safe and healthy pregnancy. And this is where the tide kind of turns and things get a little bit better for this young lady in the article. You are watching Shy Rosalind's Eclectic Experience. Please like, subscribe, and comments. Comments are always welcome. Likes are free. Comments are always welcome. Please let me know if you have questions. I don't mind having questions. Questions are good. And tonight we're talking, this is part 2 of my discussion on healthcare disparities for Black women. We're discussing one woman's story, and it's from a New York Times article from 2000. Hello. There we go. Yeah, the link in the article is in the chat. So, linked up with a doula. A doula is a healthcare professional that assists women through their pregnancy. They help with nutrition. They they monitor the patient to see if there's any signs of preeclampsia, things that the doula can be the advocate for the patient. They can guide them when to call the doctor, and what to do. And it's a support system in this young. So let's see. So this young lady lives in Louisiana. Let's see. She the doula. She received her doula training while she was a student at Grinnell College in Iowa. She moved to New Orleans for a fellowship in community organizing, and then she got a degree in nursing. So some doulas are nurses. After working as a labor and delivery nurse and then as a visiting nurse to Medicaid clients, she devoted herself to doula work and childbirth education. She founded Birthmark in 2011 with another doula who was motivated to provide services for women in New Orleans who needed support during the pregnancy but couldn't afford it. So, like I said, they help with nutrition, education, exercise. They monitor the patients, make sure they go to their checkups and that sort of thing. And then there was, let's see. Oh, okay, here we go. Here's a little more statistics. The scientific examination of 26 studies of 16,000 subjects, first conducted in 2003 and updated last year by Cochrane, a non-profit network of independent researchers, found that pregnant women who received the continuous support of that were 39% less likely to have C-sections. So, in general, women with see the American College of Obstetricians and Gynecologists released a statement noting that evidence suggests that in addition to regular nursing care, continuous one-on-one support provided by the support personnel, such as the doula, is associated with improved outcomes for women in labor. So, like I said, y'all, y'all, y'all want y'all want us to y'all want us to have babies. Yo, well, I can't say us because I have no dog in this particular fight, but we need we need to have more babies, and women need to do this, women need to do that. Well, yeah, you need to support your women. If you support your women, and you know you get a better outcome. Let's see. So uh so the rest of the article describes the journey that um she met with her weekly and would be with her during labor and delivery, and then 6 visits to make sure that the mother and son, she was having another son, remained healthy. Let's see, what did we do? Oh, basically the doula asked about, and then um, she considering what happened with the previous pregnancy. Um, then the doula guided her to meditation, things like that. Um, she found a new doctor, as a female doctor who specialized in high risk pregnancies and accepted Medicaid, um, going to a different hospital. And the other thing that the doula does is review the plan for the delivery. Um, let's see. Let's see. There's some more statistics, and I'm gonna get to the I'm gonna get to the good part. I promise. It does have a happy ending, y'all. I'm just gonna get to this. Let's see. Let's see what happened. Then the reporter who wrote the article herself has had children, and she had issues with her baby. So it's anybody. There's no guarantee that you're going to be treated properly. Um, and that is one of the affirmations the young lady wrote. They actually induced labor um, ahead of the due date because of her previous pregnancy, the previous stillbirth. They didn't want to take any chances, so they were going to induce labor. Um, let's see. And then, of course, they messed up her epidural. I mean, something had to go wrong. And then a medical resident who was white, like all of the staff who would attend throughout the labor and delivery walked into the room with paperwork. She asked, "Have you had any children before?" So this means that the resident didn't bother to read the chart. And her response was, "Yes, I've had three babies. One died. It was a stillbirth." And then the demise was last year. The resident asked without looking up. I mean, she did treating her like crap. So the doula who was there asked to speak to the, actually spoke to the no, the nurse, and said, "Could you please make it's bringing her back to a place of fear and anxiety. She's having a high risk delivery, and I would hope her care team would thoroughly review her chart before walking into her room." Duh. You'd think that would be a duh. You think that would be a before you walk in. I mean, when I had my hysterectomy, I my crap in it. I mean, it wasn't a big binder, but she had a binder with all my paperwork, everything I signed, everything from my PCP or my primary care doctor. She had my blood work. She had my COVID test. Had my COVID vaccination. She had everything in a little binder. And she said, "Okay, this is what we're gonna. This is the anesthesia you're gonna get. This is this. This is that. This is the other. You got any questions?" I mean, what? They had me in a little room. First, I talked to the anesthesiologist, and then I talked to the surgeon. And they looked me in the eye when they talked to me. And now this poor woman, she's going through the same, started to go through the same crap that she went through the first time. But this time around, she had the doula, and the doula was able to advocate for her. Um, so the short version of it, this is a long article, but the short version is, and here we go. She had a safe delivery, a healthy delivery with her new little boy, and she was able to have her two other sons meet him, and for two up with her, and then I think, let's see, hold on, he's so cute. uh it came in a well healthy 6 pounds and 13 ounces at the time. Let's see. There's more stuff about the studies, and that's his two brothers meeting him. They're so cute. All of them are so cute. Oh my goodness, so cute, so cute, so cute. Um, yeah, I'm scrolling to the end because it is a happy ending. There's a lot of statistics in this article, but here we go. Hospital room. Da, 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 da. Let's see. And then there's several cities that now have, like, they have doula programs. Um, there's in Brooklyn, Los Angeles, Atlanta, Dallas, Memphis, Miami, Washington, and other cities for either a free or a sliding scale. The By My Side birth support program is in New York City. They offer free doula services during pregnancy, labor, and delivery, and postpartum for mothers in Central and Eastern Brooklyn. 12 doulas have served more than 800 families since 2010. So that's come on. So here's the happy ending, folks. She has settled in to her new home. She joined a church. So the church was able to gift her some furniture. Um, let's see, gifted her some furniture. So she was able to get some um, baby clothes, things for the other two boys. Um, and she was actually earning some money doing hair and makeup for church members. So she got a little hustle, a little side hustle going. She was working on money to buy a car, and she would actually apply to a community college to become an ultrasound technician. So so things going were going at the end of this particular article. Things were going better for this young lady and her now three children. Um, like I said, this article was written in 2018, so we're not sure. There's no follow up. Maybe one day they'll do a follow up. There's definitely a healthcare disparity, and we need to be aware of it. Men and women need to be aware of it, because what I'm talking about is regarding women, but men, we got to take care of our health too, take care of their health too. So yeah, it's not just women, but women have that extra, especially if they're trying to have a child and carry the child and safe delivery, if that's what they choose. I know with Roe versus Wade being overturned, that whole situation is turning things upside down. But for women who want to carry their pregnancy to term, we have to make sure that they have proper care. If you're not going to have proper care, I mean, we're going to lose more women, and you're going to lose more children. So, you know, that's food for thought. Food for thought Thursday. Let's see. Is there anything else I wanted to bring up? I think no. So um thank you for joining me tonight. I hope this was informative. Like I said, the link to the article is in the chat. I also put it in the description if you wish to look at it. And please think about what has been discussed tonight and the previous night. If you can support someone who is trying to have a healthy and safe pregnancy, please do so. If you know of someone who is a doula and you can connect them to someone who needs their services, please do so. And And I think that's it for this evening. Thank you for joining me. This has been an episode of The Eclectic Experience. I am Shy Rosalind, and hope everyone has a great evening. Tomorrow is Fun News Friday. So we'll have some fun. We'll find some funny news to talk about. And Saturday is going to be bead and chat. So I'm going to make something and live. And if there's a particular color that you're looking for that you want me to work with, let me know. And that's it for now. I'll see you guys on the next one. Everyone have a wonderful evening, and I'll see y'all soon.